to a study by the University of Cape Town. A quarter of South Africans who've not yet been vaccinated against COVID-19 say they believe the vaccines will harm or kill them. Interviews were conducted with 1,940 unvaccinated people from across the country. The study found that about 34% are willing, but there are barriers to getting vaccinated. 21% will wait and see, and 15% will only get the shot if required. To unpack this, we're joined tonight by the university's senior lecturer at the School of Economics, Dr. Katherine Eyal. Doctor, a very good evening to you. Welcome to News at Prime. So, first things first, after so much reassurance by scientists and the politicians, why is there still such a high level of hesitancy among South Africans?
Well, I guess I'm not an expert on vaccine hesitancy, but I can tell you what our data has shown. And just overall, it shows that we haven't done a great job at addressing fears, and we haven't done a great job at pushing back with sources of information about the science, but from trusted sources. So, for instance, if you ask people, what's your main reason for not getting vaccinated? Very many people say, I'll get it if my doctor or nurse says that I must. So that's a trusted source of information. And then other people will say, I know people who died right after getting the vaccine. And it's not that they know of people or know of people, it's that they know people. So there's maybe a misunderstanding that a person got vaccinated but did have COVID and unfortunately died. So they're correlating the two. So essentially, the information, it's based on what we are saying, what we policymakers, etc., are managing to let everybody know about.
Mm-hmm. Let's talk about the barriers then to people getting vaccinated. What are they, and what is the feeling of the surveyed people about those barriers and the barriers, I beg your pardon?
So we've got these four groups of people that we talked about. People who are willing to go and get vaccinated as soon as possible, people wait and see, people only if you tell me, and definitely not. And what's important is that you need tailored interventions. So it is no good pushing information at a person who is already saying, I'm going to go as soon as possible. But that person needs to have a way to get to the clinic, or they need to afford travel costs, or they don't actually know things, for instance, like you can go to a pharmacy to go and get a vaccine. For instance, 32% didn't know that you could go to a pharmacy. And then a lot of people cite no time. 60% of people who say they've got no time said they would go, but if it was after hours. So that's a tailored intervention to those people. And then the people who, for instance, are wait and sees, there it's very much a reframing. It's giving proper information and giving people an idea about how they are in society, how many other people have been vaccinated, etc.
Did you look at all, Doctor, at who the most reliable information among the surveyed people would come from? Because we've had discussions with some other academics who say some of what they've picked up is that people have a lack of trust in the government, and that is perhaps why they're not willing to go with what is being said about the safety of the vaccines and the efficacy.
Yes, it seems that definitely is the case. Even amongst our people who say that they are definitely, they're willing to go, there's still, overall, there's a very high level of mistrust of the vaccine, what it might do to them, etc. So there have been an intervention recently which brought doctors and nurses straight, to local populations, for instance, to malls, etc. And they found that that was really successful, just getting people to be able to talk to somebody one-on-one. Obviously, that approach, you need to scale it somehow. But it was shown that a trusted source of information, not the government telling you what to do, but a trusted source from someone that can be powerful.
Mm-hmm. And I suppose that's also what's worked in, for example, areas such as Limpopo, where the MEC there has said that what they're doing is they're relying on traditional leaders to spread the message, religious leaders who people have more of a closer relationship with.
Yeah, so what's also really interesting with this study, we also did a little bit of a behavioral economics intervention where we just gave different kinds of messages. We separated people up into three groups. No message. One group saying social proof. did you know at least 15 million people in South Africa have been vaccinated? And another one we called the free and easy. Did you know it's free? You don't need to register. You don't need to go to, you can go to any clinic, no medical aid, etc. And that's so small that we found a jump in people's intentions and willingness to go and get vaccinated. We actually found that compared to those who got no message, the people who were reminded about the logistics and how easy things are now, there was actually a 10% increase in willingness to go and get vaccinated, which from one small type of message was, we were amazed.
So what then happens with the findings of your survey? Are they passed on to government and taken on board immediately, or do they still need further deliberation?
So we've got a few things. We now have the full data. It needs to be properly weighted, etc., and properly investigated statistically. We are meeting with our consultative group, which is a group of policymakers, people involved with vaccine demand, the rollout, etc., and we'll be giving them the brief in January. What is so great and what we're really interested in, and what everybody who's been involved in developing the survey and study is interested in, is the fact that we are revisiting these same people in February, March. So then we'll be able to see, of the people we spoke to, did they go to get vaccinated, who went to go and get vaccinated, etc., and whether the big push that the government is doing now, what impact it has had. So I think we're going to have two sort of spreadings of our information and our results, and we think we've had a lot of interest so far.
Dr. Katherine Eyal, Senior Lecturer at the School of Economics at UCT, thank you very much for your time tonight, ma'am.
Thanks.